As the holidays approach, I want to say welcome and thank all of my good friends for coming back to the Juicebox podcast over and over again.
Hi there, my name is Sarah, and I officially have latent autoimmune diabetes of adulthood, or LADA.
This is part 2 of a 2-part episode. Go look at the title. If you don't recognize it, you haven't heard part 1 yet. It's probably the episode right before this in your podcast player. The episode you're about to listen to was sponsored by Touched by Type 1. Go check them out right now on Facebook, Instagram, and of course at touchedbytype1.org. Check out that programs tab when you get to the website to see all the great things that they're doing for people living with type 1 diabetes. Touchedbytype1.org. If you're looking for community around type 1 diabetes, check out the Juicebox Podcast private Facebook group. Juicebox Podcast, Type 1 Diabetes. But everybody is welcome. Type 1, Type 2, gestational, loved ones, it doesn't matter to me. If you're impacted by diabetes and you're looking for support, comfort, or community, check out Juicebox Podcast, Type 1 Diabetes on Facebook. Nothing you hear on the Juicebox Podcast should be considered advice, medical or otherwise. Always consult a physician before making any changes to your healthcare plan. The episode you're about to listen to is sponsored by Tandem Mobi, the impressively small insulin pump. Tandem Mobi features Tandem's newest algorithm, Control IQ Plus technology. It's designed for greater discretion, more freedom, and improved time and range. Learn more and get started today at tandemdiabetes.com/juicebox. Today's episode is also sponsored by the Eversense 365. The Eversense 365 has exceptional accuracy over 1 year and is the most accurate CGM in the low range that you can get. Eversensecgm.com/juicebox. And do you see less significant spikes around food?
Yes, like here's a really good example. I currently have an addiction to Sprite, which is terrible. I have not, since my diagnosis, I probably had 2 regular soda pops in that entire, sodas in that entire 7 years. When I started Mounjaro, I had some belly upset and all I wanted was Sprite, and I was able to dose for it and not go into the 350s, which that's never happened to me in my life. And it's something is totally different. I can manage this with insulin and it's not going to put me over the edge, which to me is mind blowing.
Do you know, I just was actually working on something this morning before you and I jumped on, and I didn't realize we'd be talking about this, but I'm pulling together a list of current trials or ideas for trials that are going on right now for GLP. Beyond weight and type 2 diabetes and prediabetes, it's also being looked at for cardiovascular disease, heart failure with preserved EF, chronic kidney disease, peripheral artery disease, general CV risk reduction in obesity, obstructive sleep apnea, MASH, NASH, I don't even know what this means, MASH, NASH, and NAFLD Essence Phase 3 and other programs, alcohol-associated liver disease, Alzheimer's disease, Parkinson's, alcohol use disorder, knee osteoarthritis with obesity, polycystic ovary syndrome, acute ischemic stroke. They are looking into it for, let's see what else. Anemia, let's see, there are no anemia treatments right now in a large cohort. Inhibitors were associated with lower incidence of anemia with GLPs. Dermatology, not definitive, but they're starting to talk about it as possible eczema treatment. There's strong evidence for joint pain, osteoarthritis, and there are active trials right now about long COVID recovery. Yeah, so it takes people like you who sit around and think, what else do what do I not know right now? What should I be looking into? And what things are, maybe sound crazy, but aren't maybe not worth a shot. I'm not particularly ready to talk about this yet. I went to my wife 2 weeks ago. She was what I will call 7 weeks deep into a long COVID flare. She was melting. I don't know how she was alive even. And I said, Kelly, listen, I said, there's some people online And I shudder to tell you this because I think first glance, these are not people who I'd listen to and go, all right, let's try it. I was like, but this thing that they're talking about, it's very low impact. It takes a month to figure out if it's going to work. Why don't you try a 7 milligram nicotine patch daily and see if it will help with your long COVID? There are people who are saying that it's helping with long COVID. And I said, I don't have all the details, but something about the spike proteins and how they grab onto the nicotine receptors, blah, blah, blah. Like, I don't know. I'm just telling you, like, that's it. My wife looks at me. She's like, you're an idiot, blah, blah, blah. Yeah, and I was like, all right, fine. Like, whatever. Maybe a week later, I'm interviewing somebody and she says, I have long COVID, but it's getting a lot better. I said, oh, no kidding. What are you doing for it? She said, oh, I've been wearing nicotine patches.
Wow.
So I went back downstairs and I said to Kelly, I'm like, listen, it is not going to hurt you to wear a nicotine patch every day for 30 days. Like, it just isn't. And I ordered them and they're coming, and here, slap this on. And it's been 2 weeks and you should see how much better she is.
Wow. Really
kind of crazy, right? And so then I dug around in it a little more, and there are people. Again, this isn't studied. I'm not telling you. I mean, there are studies about nicotine, and you can go find them for yourself. But this isn't widely studied. There's no doctor running around telling you to try a nicotine. I'm not telling you to try it. Right? But there are people who say that they use it locally on joints to alleviate RA symptoms and blah blah. And I'm like, this is I don't know if that's true or not. I want to be completely clear, but that's what you need. You need people to say, here's the whole toolbox. I wonder what this would do. And not just randomly. I don't want you hitting I don't want you hitting a nail